future. It's important for the loved ones who are here. It's important for the fall weather when it comes around. And when the governor may think he's embarrassed because the numbers aren't 6,400, they may be 11 or 12,000, his embarrassment doesn't rise above letting you into nursing homes to visit with your loved ones, or finding those numbers to plan what can happen in the fall weather. And one last thing I'll say. He's a very bright and intelligent person, the governor. I know you're going to say he isn't, but I think he's very bright and intelligent. He knows from history the cover-up is always worse than what you're trying to cover up. So give us the numbers, let us come back into session, and pass my bill for an outside, independent, bipartisan investigation, a commission with those types of subpoenas so we can find the numbers. And you do care about the future. You do care about patients in the future. You do care about the patients that are in nursing home. It's not that you don't care. You want the patients in the future to be able to have you visit, and you want them to not be a number next time when this fall weather comes around. So I have two questions. One for the governor. Are you going to give us the numbers? The second question is for the legislative leaders. Are you going to bring us back to let your loved ones into nursing homes so they can be with their loved ones and we can do our due diligence? Thank all of you, and God bless you.
Carla, Abraham, Conley, come on up here. Come on up here. By the way, look at this beautiful day, right? What a beautiful day. The angels are singing, right? The angels parted the clouds, and it's a beautiful day here in Albany. And thank you all for coming to this important rally. Come here, Carla. Tell us your story.
I want to thank everybody first for being here. And this beautiful day is brought to you by my mother, Rosie Abraham, who lost her battle on October 4th, 2020, due to isolation, failure to thrive, and neglect. My mother was starved to death. She was dehydrated. The last time I saw her was March 6th. I saw my mother every single day. I fed her. My father fed her. We took her out. I got her toes done every 2 weeks. She fell, broke her femur on December 6, 2019. They told me she'd never walk again. And she didn't. She almost did, because my father and I gave her physical therapy when the nursing home told us she doesn't understand. I got her to stand. The aides took a picture of my mother standing when they told me she couldn't. We were working on her walking, and COVID hit. They locked the door. My mother didn't understand. I didn't understand. After 2 months, why can't I get in? My mother's losing weight. My mother's lethargic. Oh my God, my mother is going to die. I made phone calls. Every day I talked to the nurses. Every day I was told, she's great, she's good, she's eating, she's drinking. My mother died from severe dehydration, sepsis from a UTI they didn't catch, a pressure ulcer on her backside that would turn your stomach. If I could show you the picture I took of my mother on September 27th After 7 hours of fighting to get her to an emergency room, she looked dead. They admitted her to ICU. 2 days later, on a Tuesday, they said, Carla, it's time for comfort care. They moved us to a private room. I didn't leave my mother's side. My sister didn't leave my mother's side. My father, none of us did. The grandchildren came. On Thursday, October 1st, they moved us to the Siegenthaler Center in New Hartford, New York, which is hospice. I had the honor of telling my mother I was going to bring her home because that place resembled home. And I slept with her every night. I took naps with her. I am lucky because that whole week, I told my mother everything I ever wanted to say to her. But how many of you aren't going to get that chance? Way too many. I've been advocating for the essential caregiver plan for months. It's not my plan. Okay? I've helped revise it. I need Governor Cuomo to stand up and put this into executive order. This is what we need. You have the plan, Governor. It's foolproof. It will keep our loved ones safe, and it will bring them back to health. It's not just our seniors. It's our husbands, our young adults, our middle age, our children are in homes without their parents. How dare you? How dare you take this away from us? The only people who can keep our loved ones alive and happy. Let us in. Pass the essential caregiver plan. Today, I'm going to challenge our governor. I give you till Friday to put this in executive order. Anything after that is still pure criminal. Criminal. And let's not forget, people, we have rights. We have rights. Stand up. Use them. Use all of them. Because they can't really keep you out of these nursing homes. We have our rights. Our seniors have their rights. If Cuomo refuses the essential caregiver plan, I back all of you to walk in and take back your nursing homes. Thank you.
Thank you, Marcela. Thank you, Carla. I'm sorry, Carla. Carla, thank you. It's our stories that will change laws. It's our stories that will help change the laws so that this doesn't happen again. It's not over. The governor has written a book like The Pandemic is Over. It's like Mayor Nagin writing a book after Hurricane Katrina hit. And this pandemic, coronavirus, in our nursing homes has taken more people than Hurricane Katrina and 9/11 combined. Where is the outrage? Where is the outrage? Why are we not seeing it on every single channel of every single newspaper? I realize that I work at Fox, but it's not about politics. It's not about politics. It doesn't matter who they voted for. My in-laws were registered Democrats. My in-laws voted Democrat. They voted blue. So why don't they count? Why don't they count?
Why don't they count? And where is all the politicians?
And well, we have some of them here today. We have Senator Tedesco is here. Senator Griffo is going to be here. I want to shout out to Empire Center. We've got Bill Hammond that's here, who has done wonderful work. If you don't follow him on social media, you need to do so. He is fair, he is balanced, and he is holding feet to the fire. And he realizes the nursing home tragedy is one that needs to be covered, one that needs to be uncovered because there's a cover-up going on. Governor Cuomo may have the power of his name on his side, and he may have the power of the Democrats on his side, but we have the angels on our side, and we're not going to shut up. Stop ignoring us and let us in. Marcela, she's one of the wonderful organizers of this event today. She emailed me, and we're so grateful for her. And she's going to tell us her story and why everyone should care. Marcela.
Thank you so much. I'm really sorry for all of us right now. I'm sorry that you've had to live the loss of your loved ones during COVID and not being able to say goodbye to them. And I'm sorry that those of us who have loved ones in nursing homes right now who haven't, as of today, been able to touch them for 7 months. My husband is in a nursing home in New York City, the worst hit nursing home. He got the COVID. He survived the COVID. I spent 4 weeks not knowing what was going on with him during the COVID, but he survived. He lived. He's 66, and I know why he lived. He lived so I could tell his story, and so we could be of service to others. When he started his medical journey 5 years ago, we promised each other that wherever it would lead us, we would help others. So my husband's a COVID survivor living in a nursing home with a neuromotor condition that has no name. And today is exactly 7 months since I've touched my husband. And I'm sorry, Governor Cuomo, that fear of COVID has outweighed the science-driven devastation of the effects of isolation. I'm sorry that we're all living this. And I'm confused, actually, because in my case, I have a medical letter from a Harvard doctor that says I can get in, that I am an essential, and that my husband's neuromotor condition that I serve for the past 5 years, 6 hours a day, needs me, because without it, he'll decline. He's in an accelerated decline. And all the video chats you show me of his face telling me he's okay, and he laughed today, but I didn't see him laugh through that video camera, all of those moments that the staff sees that I don't get to see, it's against his residents' rights. I'm his wife. I'm his caregiver. So I'm confused because I filed a claim with the Office of Civil Rights on July 23rd, asking them about this right that my husband has as a disabled person living in an institution and why I can't get in if I'm COVID negative and I'm his essential caregiver. And funny, last week they responded to me on October 9th with a letter that said there is no case because on September 17th, the New York State Department of Health adjusted their mandates to be congruent with the federal mandates. And in this civil rights letter that I have right here, all press is welcome to it, and my husband, I know, would want to speak for himself. It says that there's no case because I should be able to be allowed in. So I got a call from the Department of Health on October 4th and 5th that said, you can go in. Okay, were you going to call my facility and let them know that I can go in? No, you call them. So I called the facility. Who at the Department of Health did you talk to? Well, there was 3 different people. We'll call them. I get an email the next day. We called them. We're waiting for them to tell us what to do. This is the dance that's happening right now. The dance of my husband's life and the hundred thousands of other lives that are in facilities right now. And I'm not going to stand back and watch this happen. This vagary, this dance with our loved ones' life in the name of protection from COVID. We're creating the second round of deaths from failure to thrive, unexplained weight loss, accelerated dementia decline. And in my husband's case, he cannot move. He cannot speak for himself. Imagine, he cannot speak. He can't tell the aide, oh, I have an itch, I have a scratch, I have a pain. I did that for him. I spoke for him. So he's suffering. In his video cameras every day, he cries. I tell him, it's not your fault. You didn't do anything wrong. It's not your fault. You didn't do anything wrong. He's a victim of COVID the first time around, and now he's a victim of the isolation and lack of his medical care. And I'm done. So how dare us, right? Society, you who haven't had loved ones in nursing homes, you who haven't had to live this experience, people say, why don't you take him out of there? I have no place to bring him. I have no place to bring my husband. There are no facilities that address his neuromotor condition. He's 1 in a million, right? But he counts. My husband counts. Thank you. Bobby, you count. Bobby, you count. Bobby, you count, baby. So I would like Governor Cuomo, you mentioned on CBS News on Sunday that we need to be kind. We're all people trying to do our best. Let's just be kinder to one another. Governor Cuomo, October 11th. Well, my husband, through my voice, says, Dear Governor Cuomo, will you be kind to me and allow me to receive my wife's care? I need you to intervene as the facility defers to the Department of Health and the Department of Health defers to the facility. I haven't been hugged by my wife in 7 months. I am nonverbal. She cared for me, and she spoke for me daily for 4 years. She is the kindest woman I know. I need her. Kindly, Bobby V., COVID-19 survivor. Bobby, my love, you've done nothing wrong. I'm so sorry you have been in your room for 7 months. I am sorry that we're not being helped right now. You matter. I'm so proud of you. You're the kindest man I know. You're the strongest man I know. And I'm honored to be your wife. And Cuomo, I'm speechless. I'm speechless. Let us work with you. Let us work through this trauma response we're all in. There are 100,000 people in nursing homes right now that cannot speak for themselves, and they need their families. They need their touch. And by the way, this is October Residents' Rights Month, and I'll close with this. The Resident Rights Law, federal, 483.10 Medicaid law says that every resident in a nursing home right now has a right to receive their family supportive care without regard to sex, age, discrimination, sexual orientation, and I will quote, and I'm going to acknowledge a wonderful civil rights lawyer named Michael Sussman here, their disability. My husband's disability is a neuromotor condition that has no name, and it is a disability, and it counts, and he deserves to have his care the way it was given pre-COVID. I will test twice COVID negative for the past 4 months. I've been negative. I'm no different than a staff member. Bobby, I'm coming in. I'm coming in, Bobby. I'm going to give you that hug and that care that you deserve. I love you so much. Thank you. Janice?